Thanks, Lascia and Corla. I'd also like to join the other deputies in congratulating Minister Helen McEntee today. And first of all, Minister, I just wanted to see if there was an update in relation to not just funding for allocated to eating disorders, because I know that has been announced, the funding that wasn't spent before, but in relation to the number of beds for inpatient care. As you know, at the moment it's only 3, so I'm just wondering if there's been any work on addressing that. The challenge of COVID-19 has reminded us that personal health and well-being is no longer a solo pursuit, but one that requires cohesion, collective effort and mutual respect across all life stages. In his submission to the Health Committee last October, Martin Rogan, CEO of Mental Health Ireland, highlighted that mental health affects all people of all ages. I welcome this session focused on the mental well-being of older adults who are often overlooked in these conversations. The elderly have been identified as a group especially impacted by the pandemic. Although necessary, cocooning and the closure of social outlets has increased isolation. A volunteer on a loans support line reported to RTE that a lot of the issues people would ring with would stem from loneliness. The difficulty of bereavement at this time has taken its toll. The clusters of COVID in nursing homes was a major source of distress. While the vaccine rollout and safe reopening of society will make a significant difference, we can't let the lessons of COVID slip away. Firstly, we need to fund mental health. The World Health Organization recommends for countries to dedicate 12% of health spending to mental health care. In Ireland, it's less than 7%. Not only must the Minister ensure adequate resources are allocated, but you must also secure special interventions to treat pandemic legacies. For example, reduced activities for older adults living with dementia has caused distress and exacerbated behavioural and psychological symptoms. And nursing home residents have experienced relapse of their mental health due to restrictions on visitors and therapies. While these measures were necessary to save lives, we must now act quickly to alleviate any regression. Now that we're seeing increasing numbers of older people and healthcare professionals who are vaccinated, we need safe ways for them to interact as soon as possible. A multidisciplinary approach needs to be at the centre of this response. Increases in depression and anxiety are strongly related to declines in activity, a crucial factor in well-being of older adults, sleep quality and cognitive functioning. Geriatric psychiatrists, psychiatric nurses and psychologists can drive medical treatments, but we also need occupational therapists, physiotherapists and other therapists to help provide holistic care. I know from community hospitals in West Cork that music and art therapists have an incredibly positive effect. We need to ensure these professionals are facilitating getting into hospitals and nursing homes as soon as possible. Secondly, who cares for the carers? The difficulties faced by our older cohort is also experienced by their carers and their families. Carers are consistently undervalued by governments. The amount of supports and payments offered to them compared to the work they do, the care they give is disgraceful. Yes, they receive plaudits, but they need more, much, much more. Family Carers Ireland's budget submission called Life After Lockdown outlines the measures they need, such as an increase in the carer support grant and increased home care hours. We need the government to implement these proposals. A holistic response to the mental health of older people will recognise the vital role that carers play. Thirdly, the Mental Health Commission's report on services for older people released in December is sombre reading. It clearly states, despite the increasing elderly population, we are currently not providing a nationwide comprehensive mental health service for older people. We have highly trained and committed specialist clinicians, yet we only have 66% of the recommended number of specialist teams, which themselves are only staffed at an overall level of 54%. The author, Dr. Susan Finnerty, highlighted an alarming under-provision of acute mental health beds for the elderly and serious under-resourcing of community mental health services for the same population. She also explained that older people's mental health is an increasingly important area of public policy that does not get the attention it deserves. That needs to change, and it needs to change now. The government must vigorously address the issues raised in that report. The World Health Organization has stressed 2 interconnected elements to help improve the mental health of older people by alleviating feelings of anxiousness, anger, stress, agitation and withdrawal. Firstly, the practical and emotional support through connections with family and community. Secondly, the role of healthcare professionals in providing expert help for individual needs. Over the past year, we've seen families, neighbours, volunteers and whole communities provide the first type of support. Now we need the state to deploy all its resources to address the second.